Being comfortable in your own skin is a journey, and at times it's a challenge, especially for us women. Sometimes it's what's in your skin that stops you from being comfortable and being confident. One of the biggest challenges is not being able to wear bathing suits or shorts or even skirts because of noticeable unsightly veins in your legs, or maybe feeling self-conscious when you do wear those things. It can be hard to look at yourself in the mirror sometimes, and it is time now to take those shorts back out and get comfortable in your own skin. Here to tell us how is Dr. Seema Kumar of Vein Clinics of America, who is here as part of our My Health and Wellness series. Welcome to the show.
Thank you, Beth. Nice to be here.
These nasty, as people want to say, veins that you see, people have probably seen them on their grandmother, varicose veins, things like that. What are they?
So it's a good question. Varicose veins are basically diseased veins. These are veins that are not functioning properly. And what veins are meant to do is bring blood from out back to your heart. So when varicose veins exist, it's because the vein wall has weakened. The valves inside the vein that bring the blood back up to your heart are not functioning anymore. And so blood tends to pool in these veins, causing them to stretch like a water balloon. What you see are spider veins, big ropey varicose veins that have expanded because that blood is pooling in the veins. What you can feel actually is heaviness, itching, burning, restlessness, swelling. So often what you see is correlated to what you're feeling.
So what are some of the causes of these things?
Yeah, usually it's a hereditary predisposition. So many of the times if a patient has one parent who has this, they have 40% likelihood of having it also. If they have two parents who have venous insufficiency or varicose veins, they have an 80% likelihood that it's going to occur. That is the #1 factor. In 20% of patients, it occurs even without a known family history.
Now, I would think there are probably some misconceptions about things like varicose veins, even the spider veins. Even I said it at the beginning. You think of maybe your grandmother, you think of someone older. Is it just happening to older women, or when does it happen? Does it happen anytime?
So actually, patients usually present to us around in their mid-30s to 40s, but they've often noticed it well before that.
Really?
They often notice in their teens or 20s, but the condition is a progressive condition. So when they actually start seeing that it's progressing, and they actually may even be starting to feel the symptoms of it, is often when they come to us for evaluation. But it can start in the teens and 20s, and then it progresses as it goes along.
So as early as the teens. Is there any way to prevent this, even if you're genetically predisposed?
Not really. Prevention is not a mainstay of managing this condition because it is hereditary, unless you pick different parents. Really, what it comes down to is management. And because it's progressive, the mainstay of treatment is early detection, good evaluation, and treatment so we can manage the condition and not let it progress as it would unchecked.
Well, let's talk about the treatments then. What treatment options are available?
So we're actually very fortunate. Treatments now are non-surgical, minimally invasive, and really do not impact the activities of daily living, and people can continue to function in their daily lives. What our two most common forms of treatment are endovenous laser ablation and sclerotherapy. What that really means is we're using heat energy from a laser source inside the vein and injections into the vein to seal down the diseased portions of the vein and letting the blood then return up through your normal, healthy, functioning veins. So your legs feel better and they look better.
Technology amazes me that we can actually keep up with our normal activities while you're also getting these treatments. Is there a high cost that's involved with this, or is it something that insurance can help with, that insurance can cover?
Well, this is a very important question for our patients. Majority of our patients are covered by insurance because it is a medical condition. At Vein Clinics of America, we're in network with the major insurance carriers in the country. And what has to happen is the patient comes in, we have a discussion with the physician and assess what's happening with that patient. And then we also have a discussion with our highly specialized trained staff who can determine the insurance benefits for that patient. And really, we can try and ensure that the patient gets the treatment that they need to feel better and look better.
So if people are starting to see signs maybe in their legs and they're thinking about getting a treatment, what should they be looking for in the physician that they choose for treatment?
Well, as with any other field of medicine, you really want someone experienced. This specialty is called phlebology, and so you really want to find someone who's a board-certified phlebologist, someone who knows how to treat everything from spider veins to varicose veins, really so you can get your best outcome. And again, early detection, early management is going to get you the best outcome.
Well, I have detected some spider veins in my legs, so I'm coming to you guys.
We're ready to have you, Beth. Thank you.
Thank you so much for joining us.
Thank you.
We appreciate you being here. For our viewers out there, if you want to learn more about varicose vein disease, visit the website veinclinics.com.